I'm Dr. Smriti G. Solomon, Principal Index Nursing College, Malmachal University. Today I'm going to take lecture on Principles of Psychiatric Nursing. So now let us see the principles of psychiatric nursing. A nurse must follow the principles of psychiatric nursing and maintain safety, comfort, privacy and confidentiality of the patient while providing nursing care to the patient. So when the nurse is with the patient, should maintain safety of the patient, comfort and privacy of the patient and the confidentiality of the patients while the nurse is with the patient. Number 1, accept the patient as he is. Convey the feeling of being accepted, loved and cared. Always call the patient by name. Show professional interest in the patient and talk to the patient with the specific objectives to understand patient's feelings, likes and dislikes and need of the patient. The physical need, the emotional need, the psychological needs, all the needs to be understood by the nurse when she is working with the patient. Second is use therapeutic communication techniques with the reflections, open-ended questions and focusing. Avoid evaluative, hostile and probing responses. It means when the nurse is with the patient, talking with the patient, she should give an opportunity to the patient to express the feelings. How? By asking the open-ended questions and focusing on the specific objectives, and she should avoid the probing responses or evaluative responses. Third, be an active listener. While listening to the patient, maintaining eye-to-eye contact, nod head and give non-directive comments, yes, go on, etc. That will help the patient to develop trust in the nurse. Yes, it is very true. When the nurse is with the patient, she should maintain eye-to-eye contact with the patient and she should nod the head. She should give non-directive comments like yes. That gives the patient feelings that the nurse is listening to the patient and taking interest to listen to the patient. Fourth, explain routines and procedure at patient's level of understanding. It's very true that we must understand the patient's level of understanding, and according to that we must explain the hospital routines or the daily routines and the procedures to the patient. Respect patient's right. Do not judge the patient behavior and avoid direct or indirect punishment. Never give any punishment to the patient, either verbal or restraining punishment. Next is use self-understanding as a therapeutic tool. A nurse must have knowledge about self, recognize social norms, beliefs, values and conflicts. If having any problem with the patient's behavior, then nurse must differentiate the subjective social norms from the fact. Discuss personal experiences with the colleague and with healthcare team members and use self-understanding as a therapeutic tool while providing care to the patient. Next is use consistent behavior with the patient. It will help to develop nurse-patient therapeutic relationship, to increase patient's trust, confidence on the nurse, reflect consistency in attitude, ward routine, and defining the limitations and reinforcing positive behavior. The nurse must show the consistent behavior with the patient. It is very necessary. When patient is demanding anything extra which cannot be given to the patient, the nurse should explain why the demand cannot be fulfilled. So she should have a consistent behavior with the patient. Reassure the patient in subtle and acceptable manner. Avoid false reassurance and promises. Provide an outlet for his anxiety. It is very necessary for the nurse to avoid false reassurance and promises. Never promise the things which cannot be fulfilled and which is not good for the patient's health and the treatment. Instead of that, the nurse can provide opportunity to the patient to outlet his anxiety. It means she should be with the patient and listen to the patient when patient shows any anxiety or emotional problems or physical problems. Nurse should listen all these very carefully, but at the same time never give false assurance and avoid giving false promises to the patient. Next, change patient's behavior through emotional experience. Help the patient to understand self and develop insight through role play, sociodrama, and transactional analysis. Next, maintain therapeutic nurse-patient relationship. Focus on personal and emotional needs of the patient and analyze the interaction with the patient. So it's necessary for the nurse to analyze the interactions being done with the patient to find out the personal and the emotional needs of the patient which can be fulfilled. Next is avoid physical or verbal force. If it is necessary to use physical restraint, explain the reason to the patient and the time duration when going to remove, and restrain the patient quickly, firmly with the help and attend the basic needs of the patient. It means when the patient is physically restrained, it is nurse's responsibility to attend the basic needs of the patient. Next, identify the strength and weakness of the patient. Always focus on strength. Involve the patient in activity that will reinforce the strength of the patient and avoid the activity that can make the patient to frustrate to complete the activity and may have again the anxiety and stress in the patient. So it is necessary for the nurse to identify the strength and the weakness of the patient, and according to the strength of the patient, the active patient is involved in the activities. So this is all about the principles of psychiatric nursing.